Now, our guest physician today is a developmental and behavioral pediatrician. He is also known for his work in reaching out to children with special needs. And he is the founder of A Child's Dream Foundation and a member and advocate for organizations that provides special assistance to people with cerebral palsy, ADHD, autism, and Down syndrome. Please welcome to Daybreak, Dr. Francis Dimalanta. Good morning.
Good morning.
Good morning. So let's talk about first, what do you think are the most common developmental problems in the Philippines now for children these days?
As you mentioned earlier, it covers autism, ADHD, Down syndrome, cerebral palsy, learning disorders, even children on the gifted spectrum is also part of the children we take care of.
Right. And is there an increase, do you think, of Filipino children that are diagnosed with, let's maybe focus right now with autism and ADHD?
Yes. In fact, it's a worldwide phenomenon, and the rates have increased, although it may be due to the better recognition of these disorders. I would correct myself. It's not a disease because you can't get sick from it, right? Mm-hmm. But rather, we want to try to help children to reach their fullest potential.
Okay, let's talk about first ADHD, attention deficit hyperactivity disorder.
Yes.
Okay, so what is there a cause for this when people get it, or do you think you're born with it? What is it first?
Okay, ADHD has a triad of symptoms, as you mentioned, in inattention, hyperactivity, and impulsivity. And here we need to have all these symptoms, like 6 out of the 9 symptoms for each subcategory existing in 2 situations, at home and in school, for a period of more than 6 months.
Okay.
So like a 2-year-old will not be called ADHD, but actually going through terrible twos like tantrums and all. But a child who may probably be older and teachers complaining about them being too rowdy or bouncing off the walls, or like the children we see in our clinics that open all our drawers, or is like about a little bit too much of an energizer bunny, is may have the symptoms for ADHD.
For ADHD.
Yes.
And is there a cause for this?
They've postulated on genetic causes, but there are some food groups that they say also causes this. So there's much study on the brain for the past decade trying to find out the causes of all the disorders.
The disorders.
Yes.
Now with ADHD, do some people, get older and they grow old into it and realize, so as they're adults and they realize that they have ADHD, or let's say, do some people go through life not knowing that they do have ADHD?
Yes, I think so. And the common misconception again is that ADHD is not outgrown. So you carry it on all the way till adulthood. And so sometimes even in my clinic, I would see father and son tandems, and many of the mothers complaining that I have 3 children because the first child is their husband.
Yeah, I've heard of that too. So ADHD, do people, is there a treatment for that? Is it, when you diagnose your patients with it, is it, what kind of treatment do you give them?
It's a transdisciplinary approach wherein we work together with therapists, behavioral therapists, occupational therapists, who will try to make the child sit long enough to be taught. Okay. And it depends on what the other comorbid, or like the other conditions that come with it. Because you can have ADHD and yet you're gifted because you're too intelligent, then you have all these symptoms, or you can have ADHD with a learning disability. So then again, there's a different kind of treatment intervention for such.
Okay. Now autism, you said there has been a rise around the world with autism cases as well. Now let's talk about that. How early can we detect autism, and what are the signs or the red flags that we should watch out for as parents? Okay,
autism is now described with a triad of symptoms of speech delay. So a child who is not talking by 2 years old, and there's social unrelatedness or poor social reciprocity, wherein a child cannot interact with another child or with an older person. And the third would be stereotypies, which are repeated movements which have no meaning, like hand flapping or running around in circles. And now, because of advanced researches and what do you call this, assessment skills, we can actually have an idea that a child may be presenting with autism symptoms as early as 18 months.
Okay. Now, autism is, I know that with early intervention, the child can grow and function almost just like as a normal person, correct? So how important is early assessment and early rehabilitative, which is, because you're a founder of a Child Dream Foundation, which is basically developmental rehabilitative early assessment and management. So how important is this, that you assess it as in the early stages?
You're right by saying that early recognition means early recognition. Early recognition of the disorder means early intervention and better prognosis. So when a mother, a family is in doubt or maybe can feel that there are some delays compared to other children, please raise the concerns to your pediatrician so that you can be referred to our profession, and we can actually guide you in how to go about allowing this child to reach their fullest potential.
Okay, and I know that you also have holistic care for special children in Luzon. You were part of the organization, you're a founder of the foundation. So why in Northern Luzon and Cordillera region?
I was born and raised in Baguio.
Okay.
So when I started my practice 14 years ago, I thought of giving back. Maybe primarily because of my mom and my dad, who have always been involved in civic organizations. And I was inspired and said maybe I could give back to the community that raised me. So it's in Baguio City, being run by my two sisters, Mita and Anne-Marie. And we offer, like you said, the different kinds of intervention because it's a transdisciplinary approach of providing occupational therapy, speech therapy, physical therapy, and special education services.
Okay. Is it expensive for, let's say, well, that one is you are assisting patients to get the holistic care treatment that they need. But what about those that don't have, I guess, the resources to go see, have an occupational therapist and have therapy for this? Where can they go?
I ask my family and friends to actually help out. It being a foundation, we try to pool resources and we try to come up with services for the children who are in need.
Okay, all around in the country?
Well, if they can come, because we've actually served over 20 countries and over 2,000 children since we were founded 10 years ago. We actually celebrated our 10th year last October.
Okay, and when you said, wow, that's a lot of children, a lot of patients.
Yes.
So is there like a huge increase, do you think, within the last couple of years in autism cases?
Definitely. Like I said, when I started out my practice, we were told that autism was 1 out of 500. Now it's actually 1 out of 50 children. So it's very alarming, although like we mentioned, it may not be an epidemic, but actually more because we could recognize it earlier. It was called something else before, and this is why we're having an increase in the incidences of children that we see with special needs. And I think what's more important to tell parents is that it's not their fault, and I absolve them of any guilt of what the child may have, because the key to all of this is acceptance. When a parent, when a mother and father recognize that a child may have a disorder, acceptance will be the key so that they can move forward faster.
Right, right. And what do you think is the cause of this? Are there studies or any research that will sort of point out to the reason why there is an increase?
They're postulating on and something in the environment, something probably we're eating. That's why there's a whole movement now of really being healthy and going into this wellness and fitness programs, right? Again, there's so much research that's going on. and they still cannot pinpoint the exact cause, so it's difficult to find the cure.
Right now.
Yes.
Okay, it's just basically early prevention and
Early intervention. Yes.
Early intervention, and just helping them cope
Yes.
with the environment as they get older.
Because no two children are the same. So that's the challenge to us. There are many children, they may have children with autism which will present differently in our clinics, and over a period of time we see them evolving into getting even as far as being mainstreamed into regular schooling, and that's our goal for any child.
Okay. Well, thank you so much. And please tell them about the Autism event that's happening April 2nd at St. Luke's, correct?
Yes, we'd like to invite our televiewers. We are celebrating the World Autism Day, which is on April 2, and we will be having activities from 3 to 5 p.m. on Wednesday, again to show the different colors of the autism spectrum.
All right. Well, thank you so much, Dr. Dimalanta,
Thank you
for
very
coming
much.
to Daybreak.